Hi, as you know, COVID is still among us. To talk about the latest, the new variants, here next to me is Dr. Peter Xing Hong. He's an infectious disease physician at UCSF. So Dr. Peter, tell me what is the latest for COVID? Because give an example, myself, I never had COVID, got it 3 weeks ago, and I took the medication for the Paxlovid, right? So I know the understanding of that medication you cannot combine with other types of medication, which we're going to go deeper in that topic a little bit, but what is the latest now?
Yeah, so the latest with COVID is that it's all around. People might have heard that their neighbor might have it, their friends might have it. So it's in very high levels in the community, one of the highest levels we've seen, but yet we're not seeing a lot of hospitalizations. And what that means is that people are more and more immune, but not everyone has a mild course. There's some people who are still getting sick. So we see a lot of COVID in the wastewater. We are seeing hospitals tick up. We're seeing test positivity increase. Deaths are ticking up slightly in the US. It's coming about a month earlier than last year.
Talking about water, let's say we are camping, there's a lake, you have COVID, I don't. You go in the water and then I go in with you. Can I catch COVID from you?
Yes, so COVID is not easily caught from drinking or eating or touching. It's mainly through respiratory. So if you go to the lake and you stand next to someone and you laughed and talked and sang at each other, that's a more likely route of getting COVID than by swimming in the water or by drinking the water. There are other things you can get like that, like salmonella or shigella or norovirus, but less likely COVID, which is still mainly respiratory.
Okay. So let's talk about the Paxlovid, right? So, which is a new medication. We don't have that in other countries. So what is the pros and cons about that medication?
Yeah, so the pros are if you are very high risk of getting seriously ill, it can prevent hospitalizations, in some studies as much as a 90% efficacy, and hospitalizations and death. And it's probably the biggest benefit if you are unvaccinated, older, or immune compromised. For younger people, what we found over time is that it's probably not as effective as in that older population, mainly because most younger people are doing okay right now with immune system that's strengthened from having multiple infections. But that doesn't mean to say that somebody who's younger has a very serious course of disease wouldn't probably derive benefit. The most benefit is older, immune compromised.
What about the combination with other medications?
Some medications that it may interact with includes blood thinners, cholesterol medicines, some HIV medicines. But the main thing to do is to check. There are many adjustments that could be made. And oftentimes I tell people who are vulnerable and who may need to take Paxlovid in the future to have a Paxlovid plan. That is, you don't wait till you get COVID, but before that, figure out with a pharmacist or through a provider what measures you need to take or how would you need to adjust your medications if you needed to take Paxlovid. For most patients I have, even though they're drug interactions, there are ways you can take it safely.
But can you plan that in advance?
Yeah, definitely.
How would you?
Well, I would go to my clinician and say, can you tell me if I were to get sick with COVID, what I'd need to do for adjustments in my medication so that when I get sick with COVID, I would have peace of mind knowing that you looked over these meds and everything is fine.
Are the vaccines proactive when it comes to flirt and LB1?
Yes, so the vaccines are still very effective at preventing serious disease, hospitalization, and death, but you have to get it. Most people are getting seriously ill right now in the hospital, and those people who are dying are older. They're generally older than 75, and they're very immune compromised. But the common feature with all these people is that they didn't get the latest shot, which is the one that was released in the fall of 2023. So every fall you're going to see a new shot likely for the next future. And the bottom line is, especially if you're older, immune compromised, make sure you get it updated with the flu shot. So that's the vaccine. It's probably a little bit different, the formula to what's circulating right now, which is fluoride and LB1, but it's still going to protect against serious disease. It's probably going to protect a little bit less against infection because it looks slightly different to the formula when the vaccine was released and the variant that was circulating at the time.
It's based in a different variant, right? So what would you say for some people, very personal now, when I talk to some family of my sister's siblings in Brazil, some of them say, oh, I'm not taking the vaccines anymore because people are dying, having a heart attack, having this and that. There's no scientific proof.
No, there isn't. The only scientific proof effects of vaccines right now is heart inflammation. In some people, it's very rare, and it's generally a higher risk in those who are males and who are young males or adolescent males. But people generally recover. It's not doesn't really cause deaths per se. What causes deaths is really the virus and not the vaccine.
My symptoms were, I noticed the first day I had some chills, and I thought, well, that's not usual for me when I have a cold, right? And then I thought it was weird. And then I had a little bit of fever, and I thought that's something is not right. Other than that, after the third day, I started feeling better. I tested negative on my 7th day. So is it the new scenario now? Is that what it is?
Yeah, so most people are going to get mild symptoms, sore throat, chills, fever, sometimes headache, body aches, just like if you got the flu. Some people might even have mild symptoms, but some people will have more serious disease. It's the minority of patients right now, but they're generally older or immune compromised. And they may start off with mild symptoms, but after day 7, they may need more oxygen or feel shortness of breath. So that's something to look out for.
Okay, I have 2 questions from Facebook. One from John Stevens. He's asked, are stronger COVID variants mutating in San Francisco that can evade vaccines?
Yeah, so the West Coast started off with these new fluid variants before the rest of the country. Hawaii also has very high levels right now. But they're not going to evade vaccines in the way that vaccines are still great to prevent serious disease. They are more slippery than the previous variants because they're rising to the top of the charts right now. And the reason why they're slipperier is because immune system doesn't recognize it quite as well. So that's why, even though it prevents against serious disease, it probably is a little less likely to prevent infection. Although, every time you get infected or you get the vaccine, you probably have about 1 month where you have a really strong force field against infection. But if it matches what's circulating, like what we expect the fall vaccine to do, you probably have 1 to 3 months of protection against infection, but we will still have serious disease protection for a long time, potentially a year.
If I understand you correctly, using myself as an example, I got COVID 3 weeks ago. Am I protected somehow with all the variants?
Yeah, so if you got COVID right now, you probably have a 1 to 3 months protection from reinfection. So you can walk down the street and the virus is going to run away from you because you have such a strong immunity right now. But after that point, you're going to be susceptible to getting reinfected, particularly if there's a new variant around. But it's likely that you'll have protection against serious disease for a while, maybe at least 3 to 6 months. But I'd recommend when the fall vaccine comes out to get it for protection against the winter.
Shao Guan asked if the pandemic is over, going to a large event, concerts or sports, is it safe? Do we still need to wear a mask?
Yeah, so the pandemic is not over, but the emergency response is over. But the virus is still with us, as you can tell from people getting sick right now. I would say when the virus is high in the community, if you don't want your life disrupted, you might wear a mask when it's crowded, particularly if it's indoors and you're there for a long period of time.
Do you still wear a mask?
I carry a mask around with me, but I don't generally wear a mask around right now. I got the latest vaccine, but if I'm going on a plane right now, because I don't want my plans disrupted, I wear the mask on the plane. Right now, of course, when the virus starts going down, I probably wouldn't worry about it. And that's because, I planned this vacation. I don't want to be sick on the vacation, so it's really for disruption purposes. Mm-hmm. I'm not worried that I'll get seriously ill because I got the vaccine within the last year. And if my mom were around, I would probably wear a mask in the few days before seeing her, just so that, I'd protect her. Mm-hmm. So those are reasons why you might want to wear the mask.
When do I need to get tested to see if I am positive or not? And after I tested positive, when I'll be able to be to join some people or test negative?
Yes. So when you have symptoms, what we recommend is you test at least at day 5. But if you're having symptoms early and you want to know, test, at least give it at least 24 hours or so, and then test 24 hours later if you're negative and you still have symptoms. But at the minimum, test by day 5. That's kind of like the way we think about it. Once you know you have COVID, you can stay isolated for at least 24 hours. But if you're feeling better or have no fevers, you can go out in the world, but wear a mask for at least 5 days. And potentially 10 days if you live with people who are vulnerable and you're in the same house. Testing, test when you have the symptoms, but definitely by day 5 if you want to know. And when you want to calculate the days of mask, you can go back from the time when you started having symptoms and then check 5 days after that. I know it's discouraging for a lot of people, but we have so many tools right now, and the rules are simpler. Did you get the vaccine at least once a year, yes or no? Do you know how to get Paxlovid? Do you know how to get Paxlovid if you're older or immune compromised? Check your drug interactions. And wear a mask when it feels risky or if you don't want your life disrupted, not just from COVID, but from other respiratory viruses and colds.
Last question. Talking about Paxlovid, would you recommend for your patient to use that medication, a young person with no medical record or anything serious? Would you recommend that?
No, I probably would only recommend Paxlovid at this point for those who are older than 65 or those who are very immune compromised, checking blood, checking drug interactions. For a younger person, if they really wanted to take it, I'm not going to stop it. It's FDA approved, but I'll just discuss, the benefit and risk. But again, I'm not strong or heavy-handed in denying anyone if they wanted to use Paxlovid, if it's FDA approved. There are new antivirals that will come out within a year or so that will probably have fewer drug interactions, so it may be another option. Some of these new antivirals can take 1 day off of symptoms, kind of like the drugs we have for influenza right now. So that it may be, more appealing to some people for taking a day off of symptoms.
Is the Paxlovid helps when it comes to long COVID?
So there's a theoretical benefit for preventing or lowering the risk of long COVID if you take Paxlovid, but turns out when we look at the data, vaccinations are more important in preventing long COVID than Paxlovid. There is some populations that may benefit, but they tend to be older in terms of lowering the risk of long COVID. But vaccines are probably a little bit better than Paxlovid.
And I say it was the last question, but I have one more. When it comes to vaccines, are the numbers increasing when it comes to people getting the vaccines or decreasing?
Decreasing. I think people are tired of getting vaccines, and that's why the rules or the guidelines for vaccines have been simplified. So hopefully with this next season, a new vaccine, a new formula, and when you protect against influenza and RSV, think about just getting that vaccine for COVID, especially if you're older and immune compromised.
Okay.